build and launch a dental startup and have enough patience that allows you to quit your associate position within 3 to 6 months and start being profitable faster? Here is exactly what you want to do. Hi, my name is Maritza, and I am the founder and CEO of MDent Consulting Services. This is where my team and I help dentists hit the ground running as first-time practice owners, and we give them a blueprint that allows them to build multi-million-dollar practices that are both profitable and fulfilling. In this video, I want to share with you 6 steps that would allow you to build a dental practice from scratch. You wouldn't start building a house without an actual plan, right? Or make a meal for a group of people without first preparing and having a recipe. And yet time and time again, I see so many dentists that start their first practices without this blueprint and guide, which is a recipe for unfulfilled and unprofitable practices. So let's dive in and talk a little bit about those 6 steps. The first step that I want to talk about is have a clear vision for the practice that you want to have. And by that I mean asking yourself and writing down the answer to the questions, what kind of patient gives me joy? What kind of patient do I want to treat? Age range, group, anything. You want to ask yourself that question. And also, what kind of services do I enjoy performing the most? So that you can feel like I'm going to be happy treating this person, but at the same time, this is what I envision myself doing. Short-term and long-term, and I mean that clinically. You also want to ask yourself the question, where are these patients? Where can I find these patients? And can they afford my services? Do they have the disposable income? Another important question about your vision has to do with how competitive is the area going to be where you plan on opening, that you know those patients are congregated, your potential ideal patient, right? So that's the first step. Now let's talk about step number 2. Step number 2 has to do with understanding your current financial situation. Do you have student loans? And are you currently thinking about buying a house or drive a fancy car or getting a lease to a car? If practice ownership is in your plans, you may want to start managing how you get into certain spending habits and creating a personal financial plan. I actually had a dentist once who was a client of mine who reached out to me years ago and said, I'm an associate right now, but I know that I want to start my own practice in about a year or 2. She started by cutting down on her expenses. She actually downgraded and moved into an apartment and actually got a roommate. She stopped going out for dinners, and she often started to really look at positioning herself financially to qualify for the type of lending to open a practice where she envisioned opening her practice. Personally, I had to sell my first house and downgrade in order for me to to lower my expenses when I made the decision to start my own company. So these are some of the sacrifices that when we make the decision to start on our own companies, that we need to take. And trust me, it pays off. There's absolutely nothing like starting and growing your own business. So let's talk about step number 3. And that is when you have a clear vision and a financial plan, now you're ready to start actually looking for the potential areas where you're going to start looking for a location. And what I want you to do with this step is really maintaining a good, clear alignment between your vision that you worked on already and the needs of your ideal patients and where they are actually going to be found. I have seen so many clients that get talked into this potential opportunity or more or less space than what they had planned for, and they end up being miserable simply because they actually ended up in a location for 10 years or so that is not in alignment with their vision, either treating the wrong patients or the space was too expensive and the community didn't have the disposable income, and they're not able to really have a thriving practice, and that makes them unhappy. So stay away from that. Step number 4 is understanding that you need to hire a good qualified team of advisors. You cannot do this on your own. You're going to need a good broker that is not going to sell you into an opportunity that is just going to work for their commissions. You want a good attorney that is going to help you review all of the legal documents and so on and so forth. And you also want a mentor, someone who has already a business that you can replicate, or a consultant that has been there, done it, and can guide you. What you want to do is you want to decrease your chances of failure and costs, unnecessary costs, and increase the timeline that is going to be for you to be profitable and be able to get your office off the ground soon, okay? So when you're speaking with these consultants and with these companies, ask them questions such as, do you participate in any affiliate kickbacks or anything with companies that you're referring me to, so that you can basically cut through the noise and work with really good people. Step number 5 has to do with learning to negotiate all of the deals. You need to negotiate with your landlord the terms of the lease and the competitive clause. You want to negotiate everything, free rent, tenant improvements. You want to negotiate with vendors and get multiple bids from different companies. I have seen so many dentists who feel personally inclined to ordering from one vendor simply because they know them, they have a relationship where they like them. And this is one thing that I want you to do. Learn to like your business, because your business is the vehicle for you and your family's financial well-being. And make sure that you put that first above any relationship with any vendors. They're looking to feed their families. This is your business. You also want to negotiate reimbursements with the dental insurance companies for if your project, it's insurance participation, it's part of your business model. You want to learn how to negotiate, build relationship with insurance agents, and understand how insurances work so that you can do that. Lastly, as part of the negotiation piece, you want to also learn to negotiate hiring with the people, because you're going to be competing with large DSOs for top talent, and they have more resources than you do. So you want to make sure that you do that. And finally, step number 6, you want to learn and create systems around the hierarchy of needs of a successful business from before, during, and after you launch your startup. This is not a one-time done deal type thing. You have the responsibility to have a full understanding on everything that your business needs in order to thrive, not just survive. Do not, and I mean this from the bottom of my heart, do not release the outcome of the results to an outside company or individual. Understand how insurances work and leverage reimbursement. Create a plan for attracting and retaining good quality people. So guys, to recap, if you truly want to launch a dental startup that has enough patience, that allows you to quit your associate position and focus on your own practice within 3 to 6 months from opening, you need to start by 1, having a clear vision for the business that you want to build. You want to understand your financials and start managing expenses right away. When you start searching, search and stick to a location that is in alignment with that vision that you set up from the beginning. Surround yourself with the best advisors and not follow the noise. Also, you are going to want to manage your startup costs and learn to negotiate absolutely everything with everyone. Learn, lastly, to create systems around the most important key performance indicators of practice ownership success. Let me know in the comments if you like this video and what your thoughts are. If you did like the video, make sure to give it a thumbs up. It would really tremendously help me, as I want to get encouraged to do more and more videos. And make sure to subscribe. If you are interested and want to learn more about how my team and I help dentists hit the ground running and put all their ducks in a row and build profitable and fulfilling dental practices, use the link in my description that has a link to my calendar for a complimentary consultation. I cannot wait to see your successful practice and be a part of this journey. Thank you so much for watching. Until next time.